Hey everyone, this is Dr. J. Khorsandi, back again. I don't know what happened on that first round. Tried to go live here and had some connection issues, but back again now and wanted to spend a few minutes here, spend some time answering questions, going over some latest therapies and some tips and tricks on what you can do for your snoring and sleep apnea. Hopefully some people saw our little post over the last couple days about this event and wanted to reach out to our Facebook community and our online social media and get some questions answered. I'm going to give this a few minutes to give people a chance to log on and spend a little bit of time with us. So if you do have questions, feel free to post them on here. I think there's a way to show comments here. Yeah, so if you have questions, please let me know. I'll be able to answer them and go over some different tips, tricks, options, treatments, ways to make yourself have a better restful sleep, wake up with more energy. We can go over what these things are over here. I got some of this one. I've got another one here that looks like this. I got a CPAP machine here, so I can show you what that looks like if people are interested in learning about those, pros and cons of all these different options. So let's start with where people are at. You know, once you are in and want to say hi, let me know where you're coming from. We're based in Los Angeles, so we have 5 locations. Primarily in the LA area, Encino, Beverly Hills, Pasadena, Valencia. Today I'm in Newport Beach, so this is our Orange County location. Kind of a cloudy day today. I can show you real quick where we're at if people are interested. So this, if I hit the button here, camera. So, you know, there's PCH there. For those familiar with Orange County, that's Hoag Hospital over there. Which is kind of cool. I'm in the office right now, kind of in between patients, and had an opportunity to, an opening in my schedule to answer some questions. So let me see if we have some posts coming up here. One of the, I guess we could start with some questions that I get often. You know, one of them is, I wake up with a dry mouth. And that's a common one when you have snoring or sleep apnea. You tend to be a mouth breather. Mouth breathers who go through a whole night with snoring, breathing from their mouth, are going to have a dry mouth in the morning. They're typically going to have water by the bed, and then they might end up doing some bathroom trips at night too. That could be a big inconvenience because it's another reason to disturb your sleep, to wake up, go back and forth. And one of the things we notice when we treat patients who do have multiple bathroom trips at night, that once they start getting better sleep, deeper sleep, less snoring, less apnea, that they will sleep either through the night or with less waking up, which is a big indication of improvement. Another question we get is morning headaches. So people who have waking up with a headache in the morning can be caused from different things. In the world of what I do, it can be caused from 2 things, specifically grinding or lack of oxygen. Patients who have snoring or sleep apnea are going to have a reduced oxygen intake because they're going to get blockage in their airway. When you have blockages, your oxygen levels go down. As those go down, that's going to impact the brain because that is the biggest consumer of oxygen, and if you're depriving it, it's going to tell you, typically a headache. Another analogy is mountain climbers. If you ever watch them, people who climb like Mount Everest, things like that. One of the first signs of what's called altitude sickness is a headache. Same idea, up the high altitude, there's low oxygen. So when you're able to, again, treat that, open up the airway, either with mouthpieces, or CPAP machines, or laser treatments, or positional therapy. What that'll do is that'll give you more oxygenation and a richer, deeper sleep level. Then you won't wake up with the headaches. And going back to the headache issue, that there's patients who grind their teeth. So a lot of patients will grind their teeth, and typically I used to say that was from stresses at night, or daytime stresses, life stresses. We all have jobs, families, kids, things like that. But a lot of research indicates now that teeth grinding can be happening at night because of quote unquote death stress, or if you're choking or suffocating or not breathing well, you're gonna grit your teeth, you're gonna tighten up your muscles, your tongue, and all that is an effort for you to, again, open up the airway, move the jaw, move the structures out the way. So when you combine the grinding or the clenching or the bruxism and the poor breathing and the poor oxygenation, you're gonna wake up with, potentially wake up with headaches. So those are two big ones that we get a lot. Obviously the biggest one probably is the tired of being tired. And that happens because there is poor sleep. And as you lose sleep, which can be, kind of a chronic condition, some patients will say, doesn't affect me, it bothers my spouse or my partner. Some patients will say that it's bothering me all the time. Hey, good morning, Robert. Let's see, I have a question here. Yeah. So I use a nose CPAP every night and grind at night. What is the best mouth guard I can use? So there's different mouth guards out there. There's the kinds you can get from online. They're called boiling bites. Basically, you put them in hot water and you kind of bite into them. That's kind of the quickest, easiest. Personally, I would recommend a custom one that you would get at the dental office, or something that we do. Basically, or the other option is you can kind of kill two birds with one stone, is the oral appliances that we make are also functioning as a night guard. So what happens is, patients who do wear a CPAP, who don't want to wear one or want to reduce the amount of time they're wearing a CPAP, we make them a mouthpiece similar to something like this. You can see here, and what this will do is this will actually protect your teeth. Yes, it'll protect your teeth from grinding, and it'll actually move your jaw forward. I don't know if you can see there. There it is here. And once you move your jaw forward, your tongue and your jaw are connected. So jaw goes forward, tongue goes with it. Once that tongue goes with it, then this back part of the tongue over here moves this way. So then that will help with airway opening. And in that case, you kind of get the best of both worlds, where you protect your teeth from grinding and can maybe reduce the amount of CPAP or eliminate the CPAP. But if you like the CPAP, that's also great too. So hopefully that helps. And yeah, definitely please let me know if you have any other questions. So going back to the waking up tired, basically a lot of patients who get treated and they get deeper sleep, better oxygenation, more REM sleep, more deep sleep, they're the ones that are going to benefit the most. We had an example right now this morning, about an hour ago. A patient came in, she was 38 years old, and she stopped breathing 81 times an hour. Big deal for her. She was exhausted. She says she almost crashed on the way in this morning. She had about a 2-hour drive, and she was wondering why she was having all this daytime exhaustion, why she was falling asleep, why she was gaining weight. And the funny story is, I asked her, I said, is this bothering you? And she goes, yeah, I'm feeling lousy these days, can't focus, always tired. And I said, well, is it bothering somebody else? Usually a spouse, partner. She goes, no, I live alone, but I have a dog. And she said that her dog leaves the bed and won't sleep with her. So I said, okay, well then the dog is disturbed. So I thought that was interesting. But going back to 81 times an hour is what her apnea score was, and that's per hour. And the bad news was yes, she has apnea. Good news is that we have a solution, and we gave her a solution, and it made total sense to her. I said, well, if we can reduce that by 90% tonight, you're going to be transformed tomorrow. So she had a big kind of aha moment, and we got her set up on a machine. And went over all the protocols. We actually synced it to our computers. We gave her an app and synced it to her phone. And it's going to basically measure her from tonight and she is already excited. And I told her she should have the best sleep of her life from the last 5 to 10 years. So very cool story there. I'm excited for her. I can't wait till tomorrow to log in on our portal on the website and see how she did last night. So stuff like that gets me excited. If anyone else is joining me, I see a couple people popping up over there. Let me know where you are. I'm in Newport Beach right now, Orange County. I'll give you a quick little tour. Let's go this way. I don't want to write a comment. I want to flip the camera. So there I am there. The ocean is actually right behind us the other way, that way back. But this is Pacific Coast Highway, and cars are going by over there. And I'm going to put this back down here. Hey, Fullerton. Okay, so we have another Orange County friend here. I actually grew up in Anaheim, and big Orange County person myself. I live in LA now, but yes, I have lots of friends. I used to go to Fullerton area, and it's developed a lot since I've been there. But excellent. Thanks for joining us, Robert. Any other questions out there that I could answer, or concerns, things about snoring, sleep apnea? You know, we talked about these things. This is an oral appliance. This is something that goes in your mouth at night, helps you sleep. This is a different one. There's a whole bunch of them. Philip, downtown LA. So what I would do is give my office a call, 888-317-6673 or 888-31-SNORE. It's on our website, snoreexperts.com. Best bet for you would maybe be Beverly Hills or Encino or Pasadena, maybe Pasadena. I used to live in downtown LA, and my practice used to be in downtown LA, so I'm very familiar with it. It's quite the foodie place now. It's blowing up. But yeah, definitely come and see us. Just give the office a call, tell them you heard about this on Facebook, and we'll get you taken care of. But yeah, I'm sure you've been to Bottega Louie and all those good spots down there. I do kind of miss downtown. I want to show everybody one more thing here. Hang on one second. So this is a awesome, Phil. This is a CPAP machine. So just want to show people who don't know what these things are. Let me grab this out here. This is a machine here. So for those people who are wondering what a CPAP looks like, this is what they look like. Basically, there's an air blower here. There's a screen here that gives you all the data. These things have Wi-Fi and Bluetooth, and pretty cool. There's a water chamber in here. There is Yvette. Yes, thank you. And yeah, we should have a downtown LA location. That would be pretty cool. I was actually over there, checked out that new hotel, the Intercontinental, the Wilshire Grand, and went up there and went to the pool deck and the bar and stuff like that. Very cool, cool things happening downtown. We should have a place there. That would be awesome. But that's a CPAP machine. That's one of the options for snoring and sleep apnea. It can be the go-to option for patients who are in the severe category, which we just saw one this morning. If those who are much lighter or mild to moderate sleep apnea, we have other options, things like these oral appliances, or things like the night laze, which is a laser treatment. I don't have that laser with me here to show you, but basically it's something that we can shine in the back of the throat, focus on the soft palate, and actually cause those tissues to shrink and tighten up. I like the little thumbs ups coming across there. That's pretty cool. So there's options, basically appliances, lasers, machines, positional therapy, trackers. This is actually a tracker that I wear that monitors my daytime activity. It monitors my nighttime sleeping. I'm looking at some other trackers as well to incorporate with patients and therapies. There's apps you can get on. I was going to show you my phone, but it's being used right now for the Facebook Live. But there's apps you can get that monitors sleep cycles. There's apps that will monitor breathing and body temperature and things like that. I actually wear these during the day. These are light blocking glasses. So if you see here, They're kind of a yellowish tint, an orange tint. These will actually filter out harsh light. Good question, but we'll get back to this. Robert says, does that cause pain? So here's the cool thing with laser. It does not require any anesthesia, it doesn't burn, it doesn't cut. What it's doing is actually causing tissue rejuvenation. And when we shine the laser at the back of the throat, it's causing the cells there in the soft palate to regenerate. It's called neocollagenesis. And as the collagen regenerates, the flappy tissue of the soft palate will actually just tighten up. So it will go from this to something like this. So there is no pain other than a sore throat that night. Basically, patients will say they had like a mild sore throat, like they were coming down with a cold or they had a hot cup of coffee or soup. Typically 24 to 48 hours, and but generally pain-free during the treatment. May feel a little bit of heat in the back of the throat, but no pain. You can come in during a lunch or something like that, so that's pretty cool. Did a whole bunch of those this last couple of weeks, and I think people are getting excited with the holidays coming that they want to have friends and family over, and they want to be a little bit more quiet. I had a lot of patients said they're going on vacations and they want to be nicer to the people around them. So the laser treatment has been very popular lately. So, but does not cause pain, no, in that sense. It's pretty cool technology. I'm gonna have to do another one of these in Encino and actually show you the machine. There's some videos of it if you want to see, Robert, on our YouTube page and I believe on the Facebook page, so you can kind of see what that looks like in action. Okay, how long does a laser last? Laser typically lasts about 12 to 18 months. Typically it's a 3-session treatment to start. Initial therapy, meaning that there's a 30-minute session, 3 weeks apart for 3 times. Once you're done with that, we like to do what's called a post-sleep study. So I'm assuming if you've already had a machine that they've done a sleep study on you. So if it's been fairly recent, what we want to do is once you get the treatment done is do another sleep study at the end of the treatment and see how much improvement we've gotten, typically in a reduction of what's called AHI or your apnea score. Also along with the reduction of your snoring, obviously. And then based off of that, it should be about 12 to 18 months, because what happens is as we age, our tissues turn over, things will continue to fight, gravity will always kick in, and you may need a touch-up. And typically that would be a 1 treatment session, about 18 months out. You don't need to do 3 more again. So hopefully that answers that. But great questions, and let me know if you have any other ones. People who are just joining us, I know people come and go. I know it's a busy schedule. It's in the middle of the day on Wednesday, but hopefully you can join us. I think what we're going to do is have a transcription of this afterwards, and if there's questions after the Facebook Live, you can post them in the comment section below, and I'll try to answer them during the day. But those are some of the options. Okay, Leonard says, how serious is a severe sleep apnea person? Okay, so this is a big question. Basically, the short answer is very serious. The bigger answer is sleep apnea is kind of like high blood pressure. It's kind of more of a, except for the snoring part, it's typically something that people may not give as much attention to. But what will happen is if you have a severe sleep apnea and you're not treating it, what you're doing is you're causing a stress response in your body multiple times per hour, multiple times a night, night after night. What that's going to do is that's going to cause a reduction in oxygen each time you have the apnea. That's going to put a strain on the brain. It's going to put a strain on the heart. Over time, the body's going to compensate and actually elevate blood pressure. So you're going to see hypertension, uncontrolled at sometimes. You're going to see 4 times likelihood of a heart attack, 3 times likelihood of a stroke, and typically you will see weight gain, and you will see type 2 diabetes even. So lots of medical complications come from untreating or not treating sleep apnea. So the good news is once you start to treat it and actually get better, you'll notice that there's big improvements in total life experience, quality of life. Besides, probably not disturbing the person you're with, you'll also, sleep more refreshed, sleep more deep, more refreshed, wake up feeling better, be more vibrant, lose weight, typically can get off some medications. So the ramifications of sleep apnea and treating it are huge. So when we see severe patients, I get excited because things can only get better for them. Robert, I have severe, my O2 level goes down to 70s without CPAP. There you go. Same as this patient today. And good thing that you're monitoring and tracking that, because patients who don't are the ones who are going to have the heart attacks and the strokes, because what's going to happen is when those O2 levels go down in the 70s, and they shouldn't really go below 90s, that's going to elicit fight or flight response, and eventually the heart's going to say enough is enough. I can't handle it. And there's been studies from Scripps in San Diego that said, the most common time of death is about 3 to 5 in the morning, when the body just had enough is enough. So with you, if you wanted to look at a laser or a mouthpiece to get off of the machine, what we would do is start you on one, and then we would use a kind of a combination therapy where you would do the machine and the laser, or the machine and the mouthpiece, and over time we would then do another sleep study on you without the machine, but just with the mouthpiece if you did that route. And if we see that your O2 levels don't go that low, then we know that the mouthpiece could be an effective alternative to the machine. So hopefully that helps and makes sense. Any other questions about apnea or snoring? Both of them are equally significant. Probably apnea is obviously worse, but snoring has its own ramifications because there's usually another person affected. What we call that here is second-hand snoring. It's just like if you had someone who is smoking, and the other person's in the room and you're blowing smoke in their face. They didn't ask for that or want that, but you're giving it to them. So snoring tends to be in that same kind of category. And we love fixing that, because that also makes an impact on two lives, because one, you're treating the person, and the other is you're treating the partner, the spouse, the son, the daughter, roommates. This goes down to the college level. It can even happen in the kids level. There is such thing as pediatric sleep apnea. So if you're a parent out there and you have kids that are very young and they're snoring, that could be an issue. What I would recommend is getting them checked out by the pediatrician or an ear, nose, throat, ENT to have their tonsils checked. Could be coming from that, but if you do notice that kids are snoring, if they're grinding their teeth, which is a very distinct sound, almost kind of like this bone on bone or nail on chalkboard type sound, if they are wetting their bed, or if they're extra, kind of hyper throughout the day or restless, these are all signs of potential sleep apnea, and it's treatable, and it's pretty dramatic with kids. So something else to think about. All right, we're going on almost half an hour here. Hopefully we got a couple more questions coming in, and we can address them. We talked about lasers, we talked about appliances, we talked about machines, we talked about severe sleep apnea, sleep hacks. If there's things you want to do to get better tonight, a little tip you could do is sleep on your side. So supine or back position is always going to make things worse. Sleeping on your side is going to be better for you in terms of snoring and sleep apnea. Some patients, they have what's called non-positional, which means it doesn't matter what position they're in, you can hang them upside down and they'll still snore and have apnea. So, but typically if you're sleeping on your side, that's going to be better. Another thing you can try tonight as a quick tip or trick is opening up your nose. A lot of people who have snoring and sleep apnea have nose breathing issues. So you can put a little breathe-right strip, or these little nasal dilator cones, or there's chin straps, different ways to reduce the amount of mouth breathing you do, and that will help reduce the snoring. So a couple of tips and tricks you can try tonight if you want to see if that makes a difference. Some people it does, some people it doesn't, but every little bit counts. And I got about a few more minutes, and then I got to check out and go back to work with patients. But this has been good. What I'm thinking is trying to do this more often, answer more questions, offer some solutions, basically engage with you guys, have some fun, get people better. If there's things that you want to know about or you want me to cover in a future one, just let me know. I'd be more than happy to cover different options. I have some surgeons and doctors and the sleep doctor Michael Bruce. If you saw him, he was on a little bit earlier this morning talking about sleep stuff specifically. So lots of resources for you to help you to either get better sleep, not snore, not have apnea, feel better. So yeah, post in the comments below. Let me know if there's things you like or don't like about these, or want to see or hear about, and I'll be sure to get the right people on here and have some fun, answer some questions, and hope help you guys out. So with that said, I think we're going to wrap things up, and hopefully you guys had some fun, and we'll talk to you soon. Again, be sure to follow us on Facebook, and you can check out our website. We're on Twitter as well, and Instagram, I think. So lots of ways to connect with me in my office here. We'll do one more here. Leonard says, my snoring is so extreme I can't sleep next to anyone. I cause them to worry too much, but best night of sleep I ever had was in a sleep study about 8 years ago. So there you go, Leonard. I hear that just about every hour. So what will happen is if you get a sleep study, that's called a titration study. Typically they're going to monitor you for the first half of the night, and then they're going to say, hey, this guy's got problems, and then they're going to put a CPAP on you, and that's going to then they're going to start to dial the settings and make sure that that's working for you. And typically patients will say that once that went on, they felt a lot better. At least the report will show that you did a lot better with the machine. So I'm sad to hear that was a long time ago, but if you are local, come by and visit with us. I can go over some options with you. Definitely get that snoring under control and get that sleep under control, because you only have one life, and you gotta make the best of it and enjoy it. And sleep is one of the biggest things that helps us recover, that helps us have energy the next day. It's just like charging your phone, and if you're missing out on it, or if you're not looking forward to it, that's definitely not a good thing, and we want to fix that. So thanks everyone for checking in again. I'm going to head back to work. I look forward to doing this again, and have a great day. It's Wednesday and the holidays are coming up, Thanksgiving and stuff, so make the best of it, and we'll talk to you soon. Bye-bye.